Nigel here from Bustleton Vet. Just wanted to show you something just as a way of seeing what can hide under the surface of teeth and what you may not be aware of. This is Summer. She's just about to have a dental cleaning and treatment. When we examined her, you could see this lower right canine tooth here is slightly discolored compared to the other side. And when you have a look at the tip of the canine, you can see a tiny little black spot there. When we examine that tooth, that black spot doesn't seem to be going anywhere. So we might think that that's, not a complicated issue, that's not going to cause any problems. When we shine some light through those teeth, something that we call transillumination, we start to get a bit more worried. And what I mean by worried is when I have a look at a normal tooth and I shine the light through it, that's the other side, that's the bottom left. You can see it's nicely translucent, the light comes through. This one here, when we shine the light through, you can see it's a lot darker, there's some shadows in there. That would indicate that we've got some inflammation down in the middle of that tooth. Now what we always do with any dental procedure here is we always x-ray the whole mouth, so we want to know what's happening down below that in the 2/3 that we can't actually see with the naked eye. So I'll get you to come over to the x-ray machine. So we're going to look at the x-ray viewer, and this is Summer's teeth here. So there's the tooth that is the normal tooth, so you can actually see a nice little black line coming right down the middle of the tooth. That's called up here it's called the pulp canal. Then we get down to the root canal going down there, and this is Summer's other tooth there. You can see we've got a fracture across the tip of the tooth. That little black hole actually communicates with the pulp canal, and then we've got a much wider pulp canal here, and that's what we call a pulpitis. That's painful. That will progress to having root disease down here at the apex or the tip of the root, and this tooth actually either needs root canal treatment or to have that tooth taken out. So now root canal treatment at this stage is still a referral procedure, so we need to refer that to a specialist veterinary dentist. We don't offer that here yet, but just based on picking up that disease in that tooth, the best thing for Summer would be to possibly have that tooth taken out today. So I'm just about to call the owner and let them know that we've got some serious painful disease down in the root of that canine tooth, and then I'll cross back later to let you know what we're going to do. So just had a quick chat to the owner. They are keen to have that tooth taken out. There's probably less complications with a dog's tooth, actually extracting the tooth than doing a root canal treatment. You're never going to have any issue if the tooth's not there, and certainly taking out that as a painful tooth in the mouth is going to be a lot better for Summer as well. So I'm just going to quickly show you what we are going to need to do today. So what we'll do is we'll be lifting up the gum here, so all of the gum right down to below that first premolar tooth there, and down here be sort of creating a flap of gum, and also the surface of the bone to expose that long root, which can be, sometimes if you look at the length of the crown, which you can see the white bit sticking out of the gum, the root can be maybe twice that length, so we have to take off a little bit of bone. We've got a new tool which allows us to loosen up the ligament around that tooth that holds it in without taking as much bone off, which is nice. So I might show you how that works later, and then we'll remove that whole tooth down to the root, extract it, and then stitch the gum back closed over that. So what you'll see there at the end will just be a pink area with a little stitch line in, and no more diseased tooth. So we'll let you know how that looks afterwards. Okay, so this is about 30 minutes later, after we've got the go-ahead from the owner to take Summer's tooth out, that diseased lower right canine tooth. So if you want to have a look, there's the crown of the tooth that was actually sitting outside of the gum. So if you come down and see where that would have been sitting in the mouth, it would have been sitting just out there like that, coming up just in front of the upper canine tooth. It's discoloured, it has disease right down inside the root canal, and you can see how long the root itself was, and that was sitting right down in the lower jaw bone. So what we did today is we made a little flap of tissue, we lifted that up. We normally would take bone off right down here to allow us to loosen that root. What I did today, we just got a new machine which actually is a little mini jackhammer which actually comes down right next to the root and loosens off the ligament that holds the tooth in the bone. So the benefit to Summer was that she didn't have any bone removed around that root, which is making it a lot less painful for her. I've given her a long-acting local anaesthetic block, so she'll wake up pain-free, and then we'll send her home on some pain relief tonight. And that little hole that was left by that big root being out, I filled that up with some bone graft material, so that will just form the normal jawbone as soon as possible. So that was a really good thing. The reason I'm showing you this is just to say, if you're having a look inside your dog's mouth, if you've got any discoloured teeth, and if you've got any little spots or marks on the tooth, don't assume that it's nothing. This tooth was actually going to be a painful tooth and was eventually going to potentially cause even an abscess at the tip of the root of that tooth. So I'll show you that just to say we don't really know what's going on until we have a good examination and then also take an x-ray of the teeth. So here's a close-up of Summer's canine tooth. There's the bit that sits above the gum, there's the bit that sits down in the bone, and I've drilled a little hole in the middle of the root here, as you can see, and what's come out is all this. This has all come out of the hole. This gooey looking infected nerve and pus as well was all poured out of that. So just a little fracture at the tip of a tooth, and trouble goes right the way down the tooth. So that's the end of that story.